Thank you, Mr. Warden. I wonder if you'll permit me to read the letter that really brought the whole issue to heightened state again. It won't take long. This is regarding Dr. Tomblers' letter, and this is February 2nd. Loss of good nurses. On Saturday, January 14th, an ad appeared in the Standard Freeholder from the Cornwall Community Hospital seeking registered nurses for full-time, part-time, and casual positions. One of the requirements for this position was bilingualism, English-French. I would like to comment to this ad from several perspectives. The hospital is said to be the largest employer in Cornwall, with nursing staff accounting for the largest proportion of employees. Skilled part-time nurses have been denied full-time positions, not due to lack of knowledge or experience, but as a result of the fact that they cannot pass the French language test. Many have left Cornwall and sought positions in other hospitals because of this. The reality is that the hospital functions virtually entirely in English. From the senior administration to the very board that approved the ad in question. I sat on the hospital board when French language testing was made policy. I and the other two physicians who sat on the board voted against this policy. We quite rightly made the point that nursing skills were more important to patient care than proficiency in French. At that time and up to the present, the hospital was keeping track of language preferences for all patients. This number has been consistently below 10%. The actual number of unilingual francophones is considerably less. In my 28 years as a physician at the hospital, I have never encountered nor heard of dissatisfaction due to a nurse's inability to speak French. In cases where a patient is unilingual French, there are always staff available for interpretation. The vast majority of Ontarians are unilingual English, so the ad basically discriminates against the majority of the province. I find it quite ironic that companies are relocating from Quebec to Cornwall to escape the province's restrictive language laws, which he's actually right about that. While this hospital, the largest employer in the city, has chosen to make bilingualism a priority. Essentially, the hospital is telling unilingual English-speaking nurses they need not apply. Contrary to claims that bilingualism is such an asset to Cornwall, the reality is that we are ostracizing ourselves from the rich and skilled workforce, making up the bulk of this province. This will also discourage dual-income families where one is a nurse from coming to our city. The English-speaking majority of this city had better speak up, as already calls for proficiency in French are being pushed to other professions. One clear message would be, and I'm sorry that he did, he's probably sorry he said this as well, would be to withhold the donations. And I'll end it there, but in actual fact, that's where South Stormont took notice and said, we've got to make a stand here because we, in actual fact, donate $30,000 for this year to your hospital. So having said that, I do want to start out by saying I appreciate the hard work that the hospital is doing. I understand, Mr. Spaddy, that it must be a very difficult job for you to continue to keep that hospital motivated and encouraging for the community and to keep the, you're adding on to your hospital and everything. That I can appreciate the difficulties in that. I guess where our council's coming from when we've asked the Board of Counties is why when we've had so much evidence put before us, whether it be over 2,000 names on a petition, whether it be the overwhelming emails that the mayor and myself and council have received, the letters in the paper. I mean, an overabundance of people in the community actually crying out and saying, we want to work there. And what concerns me is we're going to lose people. And you're actually only going to do better when you appear, or at least make sure that when you are trying to involve your community, that you're there on their behalf. Because that ultimately is where the majority of your funding is going to come from. So I, in my opinion, feel we need to hear from you that you're there for them and that you're going to do your best to make sure that you include the community and the employees and you make that whole working relationship inside that hospital work for everybody. And my only other comment about that is that when we talk about the nurses inside, that's all about patient care. And fundamentally, everything we're talking about here today is about the patient care. That's your concern and our concern. And that's where I need to see that it's all part of what you're going to be doing for the community.
Thank you, Deputy Mayor Hart. Someone want to respond?
Certainly, I'd be happy to respond. And I hope that our presentation today and our delivery makes it obvious that we are there for patient care. And when you encourage the hospital or myself to include the community, I can assure you that my focus and that of my team is around the patient. And that patient is the community. That's my starting point. I will, Deputy Mayor Hart, speak to a couple of your points around the hiring and the encouragement to staff. I will assure you that early on in this discussion, obviously I held town hall meetings. Helen joined me at our staff meetings. And for the most part, you can appreciate that there's quite a mixed reaction. The staff that come to the hospital work very hard. It's a very busy spot. And I think it's fair to say that they're tired of hearing about, they're tired of the impressions being given about the hospital today. They work hard to do a good job and deliver patient care to whoever presents in the emergency department or in the operating room. And you're absolutely right, not everyone can meet the language needs. And others know that they can depend on their peers to meet the language needs. But the only reason those peers are there is because we have a policy trying to ensure that they're there. It's not about every single person being able to meet every single need. We work as a team. We deliver the care that is required to whoever presents. But it doesn't happen by accident that you have the right people with the right strengths and skills. The French language requirement is just another skill, part of the skill set that we need across the organization. But everyone doesn't need to have the same skill set. But I do appreciate your recognition for what is delivered, and absolutely, I always take note when someone says your hospital. It's not my hospital, it's not the board's hospital, it's the community's hospital. The community has demonstrated that to us time and time again. We needed assistance to ensure that we have what we need, we have the resources to deliver the very best care.
And if I could add just 2 points to that. One is, in terms of evidence, I can assure you that much like your experience, the hospital experience is one where we're under the microscope. The ministry does measure everything that we do. And our reputation stands as being a hospital that delivers quality health care. That doesn't happen by accident. We definitely have the evidence, and we have provided some of it. Again, because it is a very complex organization, it may not be well known. When you bring yourself to the emergency department, you might not be interested in the stats. You probably are interested in getting the health care that you need for the problem you present with. And we do that, but we meet those needs that the ministry place on us. And believe me, they are not easy to meet. It takes a lot of hard work, and it is a team, a dedicated team at the hospital that works towards that goal and meeting those very high standards.